Okay, we're going to attempt to do this, and I sure as heck hope this works because I've had all kinds of issues. So you should have in front of you your PowerPoint while you're watching this. It's the aging adult. We'll talk a little bit about developmental theories, and you all know that every person is unique, that we all develop at different stages and at different rates, and so we have to think about those kinds of things. But there are some commonalities to everybody's development, and that we should all reach certain milestones. Now, again, we're not all going to reach the milestone of being able to walk by 11 months old, but we certainly hope that that is something that could be utilized and looked at. So what we want to look at as nurses is, are these people within reason meeting the milestones of physical development, cognitive development, psychosocial development, and so on and so forth. And so those sometimes give us a cue or a clue to whether or not the person is doing what they need to do. We classify patients or people into certain categories depending upon their age. And there's a pretty wide range of ages here, and so we need to make sure that we don't just stereotype them and say because you're 25 years old you haven't done such and so, that you're not normal. So in a young adult, the age range is pretty much late teens to mid-late 30s, about 21 to 34 years of age. And some people will be a slightly younger, some a little bit older. Usually at this point in time, people are beginning to move away from their families. They're either going off to college or they've graduated college. They're beginning their careers. They've kind of reached physical maturity, reached cognitive and social maturity. Most of the things that they do are centered around themselves. They're trying to establish a career. They may or may not start a family or start getting married and those kinds of things. They're really defining what their roles and responsibilities are, and they're becoming very independent or autonomous. Usually, they're able to do the if-then type thing. If I do this, then this will happen. And they're able to kind of rationalize those things out. They're really trying to figure out who they are, what their purpose is in life. Again, we talk about probably developing close relationships, and some of those would be very significant in terms of maybe getting married or moving in together. They usually have either completed or are close to completing their formal education, and they have the ability to problem solve. It's when we don't see some of these milestones, and particularly in a later aged individual, that we start to have maybe concerns about their ability not meeting the milestones of that age. During this time, young adult, they're also looking to improve their health status. They're looking to increase their knowledge base about everything that they can. Most of the time, there's not a lot of health issues unless they had something previously. However, they're going at a big rate of speed. They're working. They're trying to go out all the time. They're trying to do all these different things. And so sometimes the behaviors that they engage in put them at risk. A lot of times they have a very stressful work environment because they are trying to move up in the company or make a name for themselves, and so they put a lot of extra stressors on. They a lot of times don't focus on preventative screenings that we've talked about. Sometimes there are family stressors, and they really don't like to deal with acute care settings, and they don't like schedules. They want to do things on their own time. So when you're doing an assessment of a young adult, you want to obviously do a health history, and you're looking at their general health status. And do they do anything to prevent the risk and things that might occur? Ask about breast self-exams, testicular exams, those kinds of things. Most of the time when we see a problem, it's some kind of accidental injury that's happened. They may have engaged in risky behaviors such as drugs or alcohol. They may have had unprotected sex, which would lead them to transmittable diseases. Sometimes they get into real issues with being able to cope with all the stressors and things that are being placed on them at that point in time. Still need to do screenings such as cholesterol, blood pressure, and cancer checks. They still need to be focusing on immunizations, risk eye exams and things like that, and then any other kind of high risk behaviors that might be high risk for them, such as being exposed to TB or HIV. What we want to do when we're dealing with a young adult, we want to give them very specific information. We want to, if we have to have them do some kind of changes, we want them to do small things. They don't like the big picture type thing. And we want them to do something that they can really achieve success at. Use a lot of different strategies because they all go different ways, and then diagnosis of that you might see utilized during this period of time would be ineffective health maintenance. Also, the next group that we need to look at is the middle adult. I'm trying to do 15 things here, people, so I'll try to do better, okay? Middle age is between 40 and 65. It used to be that 65 was considered really, really old, and now we don't think that, and that's partly because adults are living longer lifespans and those types of things. At this point in time, we've got grown children usually, or they're at least close to being grown and out of the house. We've probably pretty much reached the peak of in our careers of where we're going to go. We pretty much have economic stability or financial stability. And at this point, we call that phase in life, and this is according to some of the theories, generativity versus stagnation. So at this point in time, we're talking about people who start beginning to see midlife transition. Up until that point, they've probably been able to produce, be effective parts of the society, to contribute, to, really improve upon things. Some people, however, become very stagnant at this point in time. They lose purpose. They don't see what they need to be doing, or how can I improve things, or what can I do to make things better. And so at that point, if they become in that stagnant phase, they start having a lot of trouble sometimes. At this point, we also see that we're beginning to decline. At age 40, we start losing our eyesight a lot of times, or at least it gets diminished. I don't think we lose it. And things that we maybe did earlier in life you might begin to see some of the impacts, and some of those might be negative, such as drug use or alcohol use or things like that. So, we don't want to get to that stagnant point, but sometimes individuals do. It can be a very full and creative time because you have the financial stability a lot of times to be able to do more things and be able to be involved in other things. And then toward the end of that period of time, toward the time that we're reaching 60, 62, 65, we're looking at retirement and what all's going to be involved in that. And that also contributes sometimes to stressors, because some people don't want to retire, and then some people realize that they didn't make plans and they haven't stocked back enough money to be able to retire in the lifestyle they want to. At this point, women start to experience menopause, and we know that menopause can cause all kinds of physical signs and symptoms. It can also cause a lot of mental stress on individuals. Children begin to move away. You have that empty nest syndrome type thing. And then if you have your parents already living close by and they're still living, then you may have to begin to care for your parents. So not only you lost your children, but now you're having to go back and become the caregiver to your parents. We're much more prone to more stress-related disease, such as heart attacks or migraines or cancers. It's because we feel that stress. We've lost our children to the empty nest thing. We're having to take care of parents and may not have the money that we hoped that we did. Common causes of diseases would be cancers and heart issues. the female risk factor for heart issues begins to increase. We would like to be able to focus more on our positive things, but sometimes all these other things that have gotten in the way kind of take us away from that. And the care that we give individuals, especially in the acute care setting, is very similar to young adults. And a lot of times the finances aren't quite as much of a worry, but they really want to be kept informed. It's a much more knowledgeable generation than we used to have. So they want to know things that are going on. At this time also, 30% of adults are overweight. Negative impacts from being too thin can also occur as well, but I see more of the overweight issues. We need to have more sleep. We're not always getting it because we have other demands on it. Smoking is an issue. Alcohol abuse can be an issue, and a lot of times you'll see people begin to use illicit drugs if they didn't do it in the past, or they may take it back up if they did. We go through that midlife crisis period. Again, that's about the 40s to 50s, and in that we call that particular generation, that 40s to 50s age group, even though it's within the adults, the middle adults, the sandwich generation, because many times you are still caring for children to a certain extent, and you're also caring for aging parents. So let's take me for an example. I had 4 children, and I had 3 of them in college. So even though they weren't there at home, I was still providing financial support, emotional support, those kinds of things. But I also had an aging parent that I was having to deal with. So I was caught in between, and that's what we call it, the sandwich generation. If you start to develop chronic illnesses, it's probably going to occur during this period in time. So your diabetes, your heart conditions, those kinds of things. And we look at something called ageism. We're beginning to age, and we're having to look at what comes with that aging process. We also may start to see personal loss. Some of our friends may begin to pass on. Other older relatives may begin to pass on. And that kind of sets in the back of our mind, we're not going to be here forever. We have a finite time amount on this earth, and we're getting closer to that point in time. So depression may also set in with all of these things. Again, major health problems would be cardiovascular or pulmonary issues, cancer, rheumatoid arthritis, diabetes. Obesity is one, and then again alcoholism and depression, and that's probably related to all the other stressors and things that we may develop at that point in time. Leading cause of death would be malignant neoplasms. That's cancer, again, that's not curable, heart attacks, strokes, those kinds of things. We might still be involved in motor vehicle accidents or falls. I know of an individual who fell off a stepladder in his garage, hit his head, and caused him to die. Diabetes causes a lot of issues. It's not just the disease itself, but the impact it has on other systems of the body. And then, again, strokes, which are cerebrovascular causes. Other things, we might see poverty if we didn't plan for or save our money. Finances have changed. We may be having to support parents and different things. We may not be able to work as much, so our finances may suffer. Health insurance is always an issue. And, health care costs are going up and up and up, and insurance costs are going up and up and up, and they don't cover nearly as much. Housing, you have a house, but now maybe you need repairs. It's been long enough that you've been in there, and you need to do some things to repair it. Employment is not always stable. You worked in the coal mines when you were in your 20s. Now the coal mines are shutting down. You may not have that job, and you may not have an educational level that would allow you to have another job. And then sometimes work-related injuries occur. So basically, when you are working with these individuals, you need to build a trusting relationship, and that's going to go with everybody. But you need to educate them on some dietary changes, some exercise, and some rest and sleep. They sometimes forget what they need to do. A lot of people begin medications at this point in time, so you'll need to do education regarding medications, continued health care screenings, continued health care office visits and things like that to manage whatever diseases or chronic problems they have. And then if they are engaging in risky behaviors and they admit it, then you may need to talk to them or counsel them or refer them to a counselor in those aspects. So at this point, you know, we're beginning to get into the group where we're talking about being aging being, you know, older individuals. And so there's some theories of how we age or why we age. And I think to a certain extent probably all of these play a role. I don't think there's any one thing that works, but for people that are theorists, they think theirs is always the right way. The first one is genetic, and this just means that we have a genetic clock, basically, that says when we reach certain ages, things are going to start to decline. Okay? And that's probably true. We know that our tissues decline. They don't remain the same. They're not as healthy and those kinds of things. So that's probably true. Immunity, a lot of times we lose some of the immunity. Probably some of the behaviors and things that we're doing increases that. But just because of our chronological age, we begin to do that. Sometimes we see chemical reactions that produce damage to our DNA and cause us to lose cells, and sometimes it could be very significant or in very vital organs. And there's another theory that says the free radical. It says molecules with separated high-energy electrons have adverse effects on adjacent molecules. I think that's all a lot of mumbo-jumbo. Personally, I think it's all there. There's also a wear and tear theory that just means that the things that we put ourselves through throughout the years are going to begin to catch up with us, and we're going to begin to see problems occur. Again, the free radical theory is genetics. I do think that we are a product of pretty much all of these. That's my personal opinion. Okay. Most of the time, aging is a gradual process. We don't just wake up one morning and say we're old, although sometimes you'll hear people say that, okay? And it's a change both in mental, physical, social, and emotional. We're pretty resilient for the most of our lives, unless you're born with a lot of chronic conditions or develop them very early. And so we're able to kind of bounce back from things. But after a while, when you continually have to do something like that, you know, your body's not able to bounce back as quickly, or it may not be able to bounce back to the full level. While you are a middle and an older adult, you still develop in all of your areas. Just because you reach that magic age of 65 does not mean you can't think anymore, you can't learn anymore, you can't physically do things. We still have the ability to all develop that, but we just may not be able to do it as quickly. We may not be able to do it to the extent of younger adults. And so we need to make sure when we are interacting with our patients and we're trying to figure out what's going on, where are they at in their developmental level? And then that's going to help us help them manage their health issues. Physiologically, of the older adult, and we're talking about 65 and older pretty much, all organ systems are going to undergo some degree of decline. Everybody's going to do that, some quicker than others. Cognitively, you really shouldn't see too much of that unless you are somebody who's developing Alzheimer's or some other kind of cognitive dysfunction related to a tumor or a stroke or something like that. Now, we do lose the ability to respond as quickly, and that has to do with our reflexes and some other things. But we still have the ability to do that on the most part. Psychosocial, we're still pretty stable during that. There's a disengagement theory that says we kind of disengage ourselves from everything around that. I don't really see that for most people. Erickson says that it's ego. He calls all of his different life stages ego, or he has names for all of the life stages. Erickson says during this point in time, it's ego integrity versus despair and disgust. So ego integrity means that you're going to go back and think about all the things you did, you accomplished, or didn't accomplish. And you can either say, I've led a productive life. I've done some really good things. I'm now going to go in a different direction, but I'm still able to contribute. Or you can say, I don't like anything that ever happened to me. I didn't make any productive impact on anything. I was a waste of time, and so now you're very disgusted and you feel like you've wasted your whole life. Havikhurst is another one, and he says that major tasks are maintenance of social contacts and relationships. And all that means is, he says that things that we do, there are major accomplishments in life, are really related to the relationships and the social contacts that we have in life. I think to a certain extent that does impact us, but I don't think that's everything. We tend to use Erickson more than anything, and I know your book had some sections in there about Erickson, so I think I would go back and review that if I were you. Physiologically, again, we talked about there's normal changes. You know, our skin changes, our hair changes, we lose hair, or we have wrinkles that develop, skin sags, those kinds of things. If we have a chronic illness such as rheumatoid arthritis, you're going to see physiological changes, you know, being able to walk, or our mobility, or fingers and joints and things. Everybody changes at different rates. Cognitively, we still have the ability to solve problems, but we may not do it as quickly or as intensively. We rely on our experiences a whole lot because we've had a lot at that point in time. Our long-term memory usually will decrease, although a lot of times things that we did a long time ago we'll remember very easily. Things that are closer to what's happening now sometimes we forget, and that's particularly true with our Alzheimer's patients. You can't just give up. You know, you need to work the crossword puzzle or the word searches or engage in hobbies where you can interact with other individuals or go back to school and take a class or something like that. You can't just turn your mind off. Okay? Psychosocial changes, that's usually the time in which we think about retirement, and that does affect us significantly, particularly if you're not prepared for it well, or if you have illnesses that are not going to allow you to do things that you wanted to do when you retired. And it's also during this point in time that a lot of individuals will lose their spouse, which is very traumatizing to them. This is just a slide that talks about going to a website or the website that you go to so that you can kind of look about what do you view or what does your mind think of when you think about an older person. And then there's a poem on the other one that's a YouTube, and I've read this before. It's really kind of sad, but I think it's a wake-up call. It's not something I'm going to test you on, but I think it's something really appropriate. Maybe you have time to go back and look at it. So the aging adult, we are the aging baby boomers. That's our generation, okay? And for the most part, we're better off than previous generations, but we're probably not, and when I say better off, I'm saying we live a better lifestyle and that kind of thing, but we are maybe not as prepared to live longer because we haven't saved as much or because our lifespan is longer and we haven't saved enough money to last us during that length of time. We in this generation tend to reject stereotyping. You know, I'm an older person. I don't often feel like I'm that old. I don't always dress that old, but I am, you know. And when I think of what I felt like at 30, when I reached this age, what I thought I would be like, I'm not that way. So we don't really like the stereotype. We have more knowledge of technology. We're probably more educated in terms of what health needs we need and what our health care expectations would be. And we're able to use various treatments and facilities and anything out there in order to maintain, you know, go to the health department and those kinds of things. We do have a specific area of nursing called geriatrics, or gerontology, and that's the study of the aging adult or the older adult, and we even have advanced degrees that can be in those particular areas. So by the year 2040, there's a lot of people that are going to be 65 and older because, again, we have this longer lifespan. And so we need to be able to have people who can take care of us that are aware of the changes, what's normal for us and what's not normal for us. And so, you know, that's an area of education that you all might think about going into if it interests you. So what's the goal of the aging adult? We want to live longer, but we want to have better quality. You know, we don't want to have to sit in the rocking chair until our days are done, okay? and we want to be able to utilize the newest and most effective procedures and tests and all those kinds of things to get us there. And we don't want to have any kind of discrimination in terms of our race, our age, or our sex. So we're kind of a demanding group right now. Again, this slide just says there's a little quiz out there that you can take, how much you know about the aging process. And again, I'm not going to test you on any of these things, but it's kind of a unique thing to look at. So, again, I talked to you a little bit about and mentioned Erik Erikson, and he's a psychology type theorist. He has 8 stages of development, psychosocial development. And each one of those stages tells you about certain achievements and things that are going to go on within a person's lifespan. And he bases it on ages pretty much. So again, older adult, age 65 and up, goes through his lifespan that he calls ego integrity versus despair. And I've already sort of mentioned this. You're either successful, you're happy with what you've done, you've met your goals, you know what you want to do from now to the time you die, and everything is pretty well satisfied. Or you can say, I didn't do anything I was supposed to do. I'm not well prepared. I don't have any money. I can't do anything. It's the gloom and doom type thing. And so depending on which part of that you go through, or which part you're in, will determine a little bit about your health care and how you progress through the rest of your life. So things that we need to think about, again, are the diet. You know, we don't always eat well when we're older. Sometimes it has to do with money. Sometimes it's because we just don't want to eat good things. And we don't always exercise. And a lot of people think I can't exercise because I don't have the mobility that I had once before. Yes, you can do some exercising. It may not be running marathons, but you can do that. Rest and sleep is often an issue. A lot of older individuals don't sleep well, or they will nap during the day, which causes them not to sleep consistently at night. And so those are some real concerns that individuals have. Stressors that might be there, again, if you've not been well prepared for what's going to come when you retire and become older, that can be a real stressor. If you still engage in risky behaviors, and there are a lot of people that do, then you're going to put yourself more at risk for developing chronic illnesses or other things that might not allow you to have a productive life for a while longer. We talked about socioeconomic risk factors, poverty, health insurance, and all those things already, and what some of the leading causes of the health problems and death are. Again, our physical strength usually declines. Our health will decline somewhat. A lot of people, even though they retire and think they've planned for it financially, sometimes they feel like they're not well prepared, and it's because the cost of everything goes up. If you have a spouse who has significant health issues or other issues, that's going to take a toll on you. Do you have people that you can relate to of your own age? Do you have friends that you can do things with and socialize with? What kind of living arrangements? This is a time when a lot of people downsize. You know, we don't need this big house. We don't have kids anymore. The grandkids come rarely. We just don't need all of that. And sometimes your roles are changing very, very steadily. You know, when you are the person that's always the caregiver, and you are the person taking care of everybody else, sometimes when it's your time to be taken care of, you resist that. And we find that sometimes with individuals. Of course, the other thing can happen too. I want all the care that somebody can give me. Again, diet is an issue, and a lot of our elderlies are overweight as well. And we have the heart disease and the stroke and the diabetes and the cancers. If you're overweight, it increases your risk of gout and gallbladder disease and osteoarthritis. And then that keeps you from being able to do the things that you want to do in life. And so you're not out with your friends. You're not in the social area a whole lot. Being too thin can also cause a problem, and we do see some individuals like that. Anorexia nervosa is it's more of a psychological disorder, but it causes the patient not to eat, and they become extremely thin and emaciated. Electrolyte imbalances can occur, and they can actually die. Again, chronic illness is going to limit some of the things that you can do, but there are ways that you can deal with some of these things, and that's part of our job, is to help them understand that. Healthcare expenses is a big, big issue, and I've already mentioned that. Family members have to learn to cope with any kind of illnesses or chronic conditions, and that's not always an easy thing. I know at this point in my life, I don't have a lot of illnesses, but my children don't recognize the fact that I can't go 12 hours a day nonstop without sitting down and resting. And it's hard for them to recognize that. Accidental injuries can occur, and a lot of times it's related to those declining physiological things that happen, decreasing vision, hearing. We don't have the muscle strength. We don't have the coordination. We have slower reflexes and reaction times. We may not be able to feel or sense things as easily. We have other chronic illnesses like diabetes or cancer or heart disease, and we take medications that might diminish our ability to recognize dangers and things. And so we have to think about the accidental injuries that might happen. And I know at my mother-in-law's house, we removed all the rugs. We've got furniture out of the way that she had so that those things are not there to impede her. We have safety devices installed in the bathroom so that she can hold on to things when she's lifting herself up and down off the toilet. And those things, she doesn't recognize why she has to have them, but they're a necessity. She can't do it otherwise. Nutritional status can be affected, not just from the fact that maybe we cannot afford to buy the healthy foods because they can be somewhat expensive. Maybe we have lost all of our teeth. My dad had his teeth pulled probably when he was in his 70s, and he never wore false teeth. Well, that impeded what he could eat, A lot of medications that we take can mess up our taste. They also can cause us to not absorb vitamins and minerals the way we need to. Reduced mobility is going to cause problems with maybe constipation. Again, economic issues. We may not be able to afford things we need. And finished taste and smell, I've already done that. And we may not be able to provide or be able to fix the food that we need, or go get them or even fix them. And that's the case with my mother-in-law. She couldn't shop anywhere right now and hasn't been able to for a long, long time. And she cannot even work a microwave at this point. So she has to rely on somebody to fix every bit of food and bring it and then help her eat it. Exercise, if we can do it, helps us. But again, if we have chronic conditions such as arthritis or something like that, we can't do that. But the goal here is that do what you can. Push yourself, because it will lower the risk of a lot of these chronic health problems that we've talked about. And exercise also helps promote appetite, your mental status, and decreases stress. So it's going to be beneficial all the way around. Rest and sleep. Most individuals at this age need about 7 to 9 hours of quality sleep. We get into problems because not only do we have stressors and things that might interfere with our sleeping, we have something called nocturia. That means we have to get up in the middle of the night because our bladders can't hold urine like we're supposed to, and so we don't sleep that consistent quality sleep. Muscle cramps often occur. Medications sometimes interfere with us being able to sleep well. If we drink caffeine, especially at night, that may keep us up. My little neighbor says if he eats anything sweet after 6 p.m., he doesn't sleep at night. Any anxiety or pain or stress, any of those things are going to affect our ability to rest and sleep appropriately. And so things that we might want to tell our patients is don't do a lot of physical heavy activity near bedtime. HS is bedtime, okay? Don't drink caffeine after supper. Try to decrease your pain and stress before you go to bed. Do your stress-relieving activities, take your medications, relaxation techniques. A warm bath maybe, reading, warm milk, whatever it takes that would help them be able to rest better. Stress is a real problem. We've talked about this. And we can't always get rid of stress. And sometimes stress is not necessarily a bad thing. For instance, my daughter got married last fall. Well, it was a really nice thing. It was great. We were excited. But I didn't rest well because I was thinking about all the things I needed to do to get ready for this wedding. So, you know, you have to think about those kinds of things. It's not always bad things that causes you stress. And so you might have to, you know, try to do some things. And I'm not advocating everybody take a Xanax, but, you know, sometimes you have to do things to help you relax a little bit. And I certainly am not advocating go out and drink and do illicit drugs, but you know, I'll get the gist here. So, what's their coping techniques? You know, what things do they have in their experience or with their families that will help them cope? You know, learning to delegate. When you're in that age group, the middle adult, you know, you kind of tend to do things by yourself all the time. You take responsibility, you handle it. An older adult may not be able to do all that. They need to learn to be able to give up some things or to delegate some things. And that's a real hard thing for a lot of people. Risky behavior, smoking, that's always an issue. And I tell students when you get into nursing school, if you smoke, when you get out, if you still smoke, there's no hope for you because everything we talk about, pretty much, smoking is one of the big things that causes it or influences it. So you really need to be careful about that. Get them involved in smoking cessation. That could be the patches, other kinds of things that you can take. Alcohol abuse occurs. It's okay to have a drink, but when you're an older adult, you don't metabolize that alcohol as quickly, so it stays in your system longer, and it can do more tissue damage and cause you to be doing things while you're still under the influence. And a lot of times we don't recognize that people are drinking that much. Too much alcohol can lend itself to causing stroke or hypertension, heart disease, all kinds of things that also can affect mental conditions such as suicide or putting you in risky behaviors that would cause your death. It affects the liver. Other medications also affect the liver because most of our medications are metabolized through the liver. And so if you damage that, then you're going to cause other issues. And then we also have the illicit drug use, and it does not have to necessarily be things like cocaine or heroin or whatever the, you know, marijuana or those kinds of things. It can be sometimes overuse or abuse of over-the-counter drugs. Chronic illnesses, things like arthritis, hypertension, heart disease, all of those things are major concerns. And again, you have to learn to deal with those health issues, be able to cope with it, and then manage your life with those diseases. And they can be, for the most part. It's just that you have to take the time to think about it, to learn about it, and to make some changes. The theory of ageism says that when you reach older age, then you become a dependent person. And up to this point, I've talked about how independent we've been. Now, as you're getting older, you have to become dependent again. And, you know, for some people, that's really difficult. You know, they've always been the one that everybody goes to. Now they have to depend on somebody else. And that causes a lot of stress and a lot of problems. The society or the social group that you belong to, how they view aging, can also affect how you feel about it, how well you deal with it. Many people think because you're old you can't talk, you don't know anything, you can't learn. And that's not true, okay? And particularly in the Western culture, we don't value our aging adults nearly as much as we do in some of the other Asian cultures or Eastern cultures. It's just not something we do. And when we're not valued, when people feel like people don't value what you're thinking or what you can do or what contributions you can make, then you self-esteem goes down. And then that causes a whole other set of issues. Again, this theory says that old age begins about 55. Most older adults are not in nursing homes anymore. We do have a lot, but they're staying home longer and longer. Sometimes they shouldn't, but they do. This theory says that older adults are sicker and mental deterioration occurs. It does, but not all the time, and not to the extent that this kind of implies. Older adults are not interested in sex. That's entirely untrue. Look at Anna Nicole Smith. She married that 90-year-old person. and they probably did engage in some sexual activity. Said that older adults don't care how they look. That's not true. We do. I still put color on my hair because I don't want the gray to show through. Okay? Now, I'm not quite in that age, but close. And then there are people that say, well, because they're old, they're not going to live much longer anyway. Let's not give them the assertive types of treatments that we would for somebody younger. And that's not true either. We need to value them and they deserve everything that everybody else has. So again, there's another video that you can go to, and it talks about ageism and some of these myths and some of these feelings that people think about. And you might want to go in and look at that. Not again because I'm going to actually test you on the video per se, but what's that theory of ageism saying? There's a whole lot of things on that previous slide that are just not true about aging adults. And here's another one about discrimination related to age. During the time that they are in this period of being older than 65, we begin to see a lot of personal loss. Your family dies, your spouse dies, your friends die. You just lose those support people that you've always had. You have to learn to live alone. Sometimes for women, that's really difficult because most of the time women live longer than men, and you often find women remarry. Men will do it too if they lose their spouse earlier on, and a lot of times it's because they can't stand the thought of being lonely and not having that womanly presence in there, to make things a little easier, okay? I know that happened to my dad. My mother died at a very young age, but my dad could not think about staying alone, so he married very quickly after she died. So it's just kind of an issue there. Sometimes, though, we do have some real cognitive impairments that occur with the aging adult. And one of those is called delirium. And delirium is an acute confusional state. So that's, it's acute. It has the potential to be reversed, but not always. What causes delirium? Sometimes an infection, electrolyte imbalance, a hemorrhage where they're bleeding, body temperature alterations. And remember, an older adult may not be able to take the variations to the extent that other people would in our body temperatures and heart rates and pulse and respirations and those kinds of things. So smaller changes can still affect them very significantly. Delirium occurs over a short period of time. They're usually not able to focus or concentrate on anything. Their mood changes. A lot of times they'll have hallucinations, hearing or seeing or both. Usually don't sleep real well. A lot of times they're up for hours and hours and hours. And a lot of times their speech is very incoherent. They can talk to you, but the sentences don't make sense, or they may even make up words. Dementia is another type of cognitive impairment, and this is where it really affects your intellectual functioning. And because of that, you're not able to make decisions about taking care of yourself, your activities of daily living, and those kinds of things, toileting, eating, all those kinds of things. It's usually a more gradual progression, but it does get worse and worse, and dementia is irreversible. So delirium can be reversed, dementia isn't. Alzheimer's, I know you all heard of Alzheimer's. It is a form of dementia, and it's one of the more common ones. You usually have progressive memory loss to the point where the patient will then not know anybody or know anything. They don't recognize objects. One word for that is called agnosia. Okay? I think I would know that term. Loss of ability to perform tasks, apraxia. So where they were able to wash dishes or fold clothes 2 months ago, they may not be able to do any of that because they can't rationalize or think how to do that. Loss of language skills is aphasia. And many times as the disease progresses, they are unable to speak anymore. They cannot talk because they don't have the intellectual component to do that. There's 3 stages. There's the early stage, it's involving memory loss. The middle stage where you begin to see language losses and motor skills, and then late, everything kind of goes away. They can't ambulate, they can't talk, they can't remain continent, so it progresses. Now, just because you experience or you see somebody experiencing memory loss, that does not mean that they have Alzheimer's, okay? Don't take it out of context. You need to look at everything that's going on. But if you have a family history of that and you see significant changes, then those are warning signs that you need to look at. Remember, though, as we age, we tend to lose focus. We tend to lose some of our motor skills. We tend to lose some of our memory loss. So that's a process of aging. It is not necessarily the actual disease. If you do suspect somebody that has Alzheimer's, however, you probably need to get them evaluated. Depression, we've mentioned this several different times. Depression is really just a feeling of there's no happiness, there's no sense of well-being, and because of that, you have a hard time wanting to eat, to do anything. You don't maybe sleep well. Some depression patients will sleep all the time. Some won't sleep at all. It's very difficult to treat somebody with depression because it involves more than just a physical ailment. A lot of people get so severely depressed they become suicidal. It is reversible. There are things that can be done, but there's also people that don't get recognized quickly enough and that they don't get the treatment that they need, and then the end result is death. 1 in 4 women, 1 in 4 kids will develop depression at some point in their life. Not everybody seeks help. We tend to be, I'll take care of it myself. I'll get over it. Okay? About 15% of the people who develop depression will commit suicide. It is a very good cause. It's not good cause, but a very the leading cause of death in some states. It is not part of aging, but you often see it in aging adults. And because our aging population is becoming larger, we may see more and more suicidal episodes. If you have a chronic illness, that's going to contribute to the risk of developing it. It can also occur after you had a stroke or an MI, a heart attack, because you think I'm not able to function anymore and I've lost all purpose in life, so I'm depressed. There you go. Cancer, most people, if you tell them they have cancer, they think of it as a death sentence, and that's not always true. Okay? And there are some drugs that can lead you to do that. And so a lot of times we don't recognize that those drugs are the contributing factors. Poverty, if you feel like you have no way of making ends meet, you may think there's a way out. Insurance coverages, particularly if you have a lot of health care costs and you don't have that insurance and you're in the poverty level, you think, how am I ever going to afford this, and they're not going to treat me, and those kinds of things. And you can't provide for your basic needs, much less for everything else that you can have. And that leads you to feel depressed and that you don't feel like your life is not worth anything, and then they do commit suicide, or at least attempt it. Again, poverty can cause problems with safety. And if you can't move, you can't improve upon that. It causes problems. You spend more time at home because you don't have the means to get out and do anything. So a lot of these things are going to contribute to either accidental injuries, or later on they may even contribute to suicidal tendencies. Physiological risk factors we've kind of talked about all over the place already. I'm not going to go back into all that. Once you hit 70, however, your chronic illness risk goes up. Okay? And that just makes sense. You're living longer, things are wearing out, you're going to get things. Okay? You have more surgeries during that period of time, but it makes recovery time is greater because you're not able to bounce back, and you're not doing mobility and activity to the extent that you were able to do it previously. Heart disease is a big one. Elevated cholesterol, again, that has to do with diet and some genetic type factors. Particularly in men before age 50 and women at 60, you're going to see it more common. And if you have somebody with diabetes or hypertension, obesity, sedentary lifestyle, and then there's a lot of people with hypertension, 1 in 3, and I'm not so sure that's not correct. It may be even higher now. Sensory defects, and we've talked about this. Your vision changes, You develop something called presbyopia, and you can't see very well, can't see far off. People don't respond to light nearly as quickly. You need more light to read. Night driving sometimes is an issue. I have trouble seeing at night, so I try not to drive long distances there. We develop cataracts. We can develop glaucoma, which is increased pressure in the eye that we don't need. And then, all those things contribute to the possibility of accidental injuries, depression. I can't see. I've always wanted to crochet. If I can't see the crochet, then, I may feel like I'm not fulfilling what I want to do. I can't do the things I want to complete. Loss of hearing is another one. Loss of hearing is called presbycusis. Okay, presbyopia for eyes, presbycusis for hearing. And normally you don't see, people do decrease somewhat their hearing, but it should not be significant. Okay, it's not necessarily related always to just aging. Okay, a lot of times the reason we lose our hearing is because of environmental things that we do. We listen to too loud music. We work in factories that has a lot of noise. Those kinds of things. But whatever the cause, sometimes individuals have to have hearing aids, or they may refuse to wear hearing aids, which is what my dad did, because he couldn't hear anything. We have to look about earwax, which is called cerumen, and sometimes that becomes very dry and difficult to get out because we have impactions, and things like that can be removed, and then the patient hears better. Okay. If you have a patient with a hearing deficit, however, you're going to have to make sure that they are where you're in the room. You talk to them in a slow, loud voice. You need to make sure they understand whatever directions you're telling them. Don't just assume because they nod their head yes and smile that they know what you're saying. Okay? Cognitive and intellectual usually doesn't decline unless you have those things of dementia, Alzheimer's, or some other medication or something that causes that. They still have the ability to think, just maybe not as quickly. They still have a lot of wisdom. And, a lot of people you can learn a lot of things from older individuals. A little bit of short-term memory loss, a little bit of difficulty with maybe math skills or word finding. Sometimes I have trouble getting the right word out. They still are able to learn. When you teach, you need to make sure they are truly learning it, not just, like I said, nodding your head, okay? But the big key from this is that intelligence does not decrease with age, and that sometimes is a myth that we think about. This is a video that you might enjoy watching. Again, I won't test you on it, but it might be something fun to watch. Mobility. As we get older, our joints don't work as well, elasticity doesn't work well, but we still should be able to move around unless we've got some chronic illnesses, okay? And so a lot of our mobility issues occur prior to us becoming an older person. As long as you are active, however, you should remain active for a long period of time during that older adult area, or older adult aging time. Your gait, flexibility, your muscle strength, all contribute to how well you can move. So if you have any kind of problems in those areas, you are going to see decreasing mobility. So the number one cause in this area would be a fall, and hip fractures are usually the result of that. And it has to do not all the time about just the fall, but because you may have bone loss, wear and tear on the bone joints, those kinds of things. So a lot of hip fractures. Culturally, depending on your culture, how is aging viewed, okay? And what kind of healthcare practices do you participate in because of your healthcare? Asian people are much different. Hispanics may be different. And so it depends on how you view aging and your health and what your culture says, okay? And so you have to take those into consideration when taking care of individuals. This is another YouTube about preventative health for seniors. That might be something you might want to enjoy and watch. There's, I think, a little section in your book as well about that. So again, when you are taking care of either middle or older adults, we're still going to do all those things that we've done before. Health history, medication, functional health assessment, physical exam, diagnostic tests. We want to look at what age level they are and what's appropriate for that age level. Remember, however, not everybody fits in the same hole. So what I can do, another 60-year-old may not be able to do, but it doesn't necessarily mean that there's something really wrong with them. And so what you're looking for as a diagnosis is ineffective health maintenance. How are they dealing with their overall general health? And is it well? Are they dealing with it well? They may still have illnesses, but are they able to cope with it and make the necessary changes, or are they not? Again, you got to have a trusting relationship. You do need to allow extra time. You can't run in there and fire questions at your elderly people. You need to give them time to think about the answers. Sometimes they won't tell you everything, though, so you need to kind of be aware of that. Make sure you give a time for them to talk as well as to listen. And then make sure you see how they feel, what their perceptions are of their overall health. Make sure you review current medications, and do they take those medications the way they're prescribed? What time do they take them? Do they know anything about the side effects, or are they experiencing side effects? And how to safely use them. Make sure you include over-the-counter meds. A lot of times people won't include that I take an aspirin every day, or I take a Tylenol at night, or I take a bunch of herbal medicines. They don't recognize those as medicines. They think a medicine is only prescribed by a healthcare provider, and that's not true. And a lot of times what we find are the over-the-counter medicines are interfering with things that they could normally do. Make sure they understand about their medications, what they need to know about them, what might be some issues that they need to address or be aware of. Look at their strengths and weaknesses. Can they drive? If they can't, how do they get their groceries? How do they get their doctor's appointments? Those kinds of things. You get them to tell you about a typical day. What do they do throughout the day? And those kinds of things. That gives you a clue sometimes about how well they're coping with their health. Watch what they say. Sometimes they will hesitate, or they may have trouble getting out what they want, or with some facial clues, or are their clothes not fitting well. And those are things that might tell you that even though they're telling you everything's okay, it might not really be okay. You do a general overall survey, just like you would for any physical assessment. Try to group things together so you don't tire them out, because remember, they don't have their residuals. Look at their general appearance, vision and hearing, taste and smell, those kinds of things, and record any abnormalities. Look at their skin. You could say that it's brown, scaly, or dry. Decreased elasticity, you're going to measure that by skin turgor. You may see some wrinkles and sagging. You may see hair that's thinning. You may see hair on places that are not supposed to be, hair on the lips and things for women. Look at their vision. Do they wear glasses? Ask them if they wear contacts. Look for hearing aids. You can sometimes tell if they're having hearing deficits because you're talking in a normal tone of voice, and you can tell they're not hearing what you're saying. Look for dentures. Ask them about how food tastes to them, if they notice any changes in their food. Look at their neck for potential thyroid issues, maybe an enlarged thyroid. Listen to the heart. Look for increased anterior-posterior diameter from front to back. That's an indicator of respiratory issues sometimes. Look at how can they say a complete sentence without having to stop and get a breath. Are their pulses in their feet weaker feeling than in their radius? Okay? Do they talk about being cold all the time? When you do blood pressures, you do a lying, sitting, and standing. And if you see a significant change from sitting to standing, that may indicate something. Look at their breath, and that includes men. Okay? Listen to their bowel sounds. Ask them about digestive issues or constipation or diarrhea. Do they take anything? Reproductive, you still want to ask them about their reproductive abilities. Men are going to have decreased testosterone a lot of times, don't arouse as easily. Women have a lot of vaginal dryness, and that may be something that they report to you. I still want to have sex, but it's hurting. Ask about their urinary abilities. Do they have to go to the bathroom a whole lot more? Are they having trouble starting their stream? Does it hurt? Do they have to get up in the middle of the night? Those kinds of things. Look at their muscle mass. Look at how well they walk when they come in. Test their reflexes, those kinds of things. Here's a picture of, you might see some, the man with the sweater on over here, he's kind of bent over and all stooped over, okay? And that's kind of an indicator of some muscle and bone issues. The other one, look at the difference in his chest. Look how wide across his area his chest is. That's not normal, okay? That's something that's different. Ask about appropriate screening. And I'm not sure I missed this. This may not be the right thing. But look for screenings, colon screenings, cholesterol screenings, blood pressure screenings, those kinds of things. You need a screening for breast cancer for women. And then sometimes they'll start doing occult blood or testing for blood in the stool to make sure they're not developing colon cancer. So those are things that you need to talk about with your patient. Ask about drinking. How much do they drink? And a lot of times you can pretty much add 2 or 3 to that. Screen for tobacco use. Make sure you know about their immunizations, pneumonia, shingles. Shingles is given after 60 years of age. A lot of insurances will cover it free of charge for that. Make sure they get their pneumonia, flu vaccine. You need to have your vision checked, because if there's something you can do getting glasses that's going to improve your vision, that decreases the risk of injury. Okay. High risk for TB. Tuberculosis was a very prevalent disease a while back. It kind of went away for a while, and now it's back again. It's a mutant strain. We're getting to see it in a lot of our nursing homes and institutional people. Here is a list of several different diagnoses that you might see utilized with people that come in with difficulties. That's not all-inclusive, but you might see some of these and they might be appropriate to what you're seeing. Make sure when you plan your outcomes that it's realistic. You can't expect them to run a marathon if they're 90 years old for most people. Make sure that they have positive interactions, target dates. Give them the information. Make sure it's some accurate information. If they're engaging in unhealthy behaviors, try to correct that or make them understand what could be better. Those kinds of things. And then at some point you may have to discuss it's time to go somewhere else. You can't live on your own. Again, education in all these areas. Plan for long-term care. How long can you live by yourself or in an environment where you can take care of most people? Where are you going to go? What kind of place are you going to go? What resources are out there for you? And these are things that people need to think about. So as long as you're caring for these individuals, you're going to be evaluating constantly. How are they doing? Are they learning from the things we've talked about? Are they managing things better? Are things declining? Try to make goals that are very realistic, but so that they reach their maximum potential. Okay? Involve the family as much as possible, assuming that they're willing to do that. And make sure that they are aware of all the safety issues that might be around. Again, you want to maintain the highest possible of independence for the longest period of time. Let the patient control the decision as much as possible. Make sure you let them know that they are respected, that you value their values. Not that you have to agree with them, but they're entitled to that, and that they can be safe while they're under your care. This is a YouTube about protecting the dignity of our older people, and a lot of times we don't do that. We think because they are old, this is awful. So they don't, we don't need to do anything with them. So look at that if you get a chance and see maybe how you feel about that. Elder abuse, does it exist? You betcha. And there's all kinds of videos and things out there, and educational pieces done, and alerting things, and we need to be on the lookout for that. You know, just because Grandpa came to live with you doesn't mean that he's being well taken care of. And this is another video that you might find interesting to watch. So that's the end of the aging adult. I tried to hit the highlights and talk about things that would be important. Eric's somebody you need to really focus on, particularly that generativity and stagnation, integrity versus despair, those kinds of things. You know, just kind of generalized information about, you know, what to expect with an aging adult. Stereotypical things that we always think about probably aren't true. The videos, they're nice. You all have a lot to do. I would hope that you would take the time to view a few of them, but I understand if you don't get to all of them. Elder abuse will be covered in another course in much greater detail than what I've said. I'm not going to spend a lot of time with that, just to make sure that you're aware of that. Okay, so what should happen is if you get in here, it's going to be under recording when you get into the Blackboard Collaborate. I hope that you can see this, and I hope you can listen. When you get the opportunity to do that, with somebody, let me know that they really were able to get in here and see it, because I've had all kinds of issues getting it loaded. So if you wouldn't mind, I'd really appreciate that. Okay, so this is the end of it, and I will talk to you later. Have a good weekend.